high sugar was, or does the high sugar come as a result of the high BMI, so they're correlated with
Good question. Well, these are standard risks that we look for. All docs will keep an ear out, and when we have everybody hitting the whole everything, that's red flag all over, but they do act independently. I can have an athlete, a marathoner. Luckily, I haven't had any marathoners. I haven't found any yet, but I can have a marathoner that only has a risk factor in the family. Or a marathoner who has a high blood pressure when he comes in to see me for a physical. I would expect those guys, even if, no, 5K or a cardio, somebody who likes cardio or cross training, CrossFit. I would expect those guys, of all the guys, to be low on their blood pressure. But typically, for the guys who are here, your first visit with a new doctor is usually hypertensive, you're a little excited, you don't know what they're going to do. You guys that are in your 50s, you're anticipating the rectal exam. So the blood pressure is a little bit high. Yeah, well, guys usually like that. Women, no big problems because I think they're used to pap smears since they're 18.
Yeah.
But so that's why when a guy comes in, I usually say, you know, give me 10 blood pressures outside this office, I'll be fine with it. And usually it goes down outside my office. But again, if there's one risk factor here, I would still, depending on the patient, I would be curious. I'd start the workup. If there's several risk factors, it makes me work even faster, or I guide at least. But you'll notice all these things are part of the history. So those of you who have insurance, you know when you go to your doc, average visit when you go to your doc, anybody throw out a number. How long does it take with your average visit to see your doctor? How long does he spend with you?
15.
Okay, 15? About right?
Longer now with EMRs.
All right. Are you in this lady said EMR, electronic medical records. It takes longer because we're actually typing in. I'm pretty good with that, so I'll usually jump and go click, 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 click. But that's the only thing that's expanded the average 12 to 15 minute visit is because it takes too much time. And EMR, electronic medical record, is supposed to speed up our time, but it's slowing it down. But in 15 minutes, if your doc is really good, he'll find risk factors. If 15 minutes, if your doc is stressed out or you're the last person of the day, then you might not be paid attention to properly. So I'm speaking pessimistically, but again, if I'm the guy that's going to be talking to your relatives and your family members about you just had a heart attack, what are we going to do now? Then I want to be upfront with you about the highest risk. So 15 minutes of history taking, it can be missed unless you're really good or unless your doc's really pressured. That would cause me anxiety if I was a patient and my doctor was firing off a mile a minute. So I don't think there's any other way around it, though. Insurance doesn't pay that much, so we have to truncate the visit. But sometimes you're on your own, so try to do as much reading as possible. And that's why these lectures are pretty good. The blood tests that we would order, or the testing that we would order, fasted lipid profile, standard stuff. That's when you fast for about 6 to 8 hours and you have a blood test in the morning. Fractionated lipid profiles. In some insurances not paid for, some people actually pay outside to have it done. It's when they spin the blood vial even faster, 4 times faster than the hospital. So they separate even the 4 things that the parameters I mentioned earlier about the cholesterols that we check. They'll spin it down so they'll separate even bad HDLs, good HDLs, bad LDLs, good LDLs. They fractionate it even further. And there is some research that says if you have a high amount of low density or thick LDL, then you're really at risk for heart disease later on. And it breaks it down into just finding more information out of getting some blood tests. But again, it's not paid for by insurance in most insurances. Cardiac CRP is an easy one. Usually it's covered by most insurances. That shows a heightened response in the bloodstream of the blood vessels of the heart suffering or going through inflammation. So when you have a high history in the family, when you have high cholesterol, and then when you have high CRP, usually it's time to go see a cardiologist to get the next step. So with people who are controlled and yet family members have passed away and your cholesterols are okay, I would still say ask your doc to get a CRP.
Is that blood test?
Yeah, it's just another blood test you add on to the cholesterol. But most of my colleagues don't get it. I'm not sure why. I also like homocysteine levels. I think cardiac CRP and homocysteine are 2 additional tests for anybody that's got high risks. Cholesterol high or cholesterol, it doesn't matter, but those are great tests to get. Homocysteine sometimes is offset by a low B12 or low vitamin level, so, but still, if it's low, it tells you that there's something to check.
CRP, how often would you get it if it was normal at one point?
I would probably do it if I had a high risk factor in the family. I'd do it every year. If that person that I'm checking every year, say I'm checking you, I'm watching you like a hawk. Obviously not in those words, but I'm trying to protect you from future damage and keep him with a dad. If I was to say that this year it looks good, I'd say, every year, get it. If I was to say somebody over here had family history of diabetes, I'd say every year, let's get an extra test just to make sure. Unless you have made a change, unless this person has brought their BMI down. If I find out that your cholesterol is great, has been great, CRP has been great, but you are now mostly plant-based diet, vegetarian, vegan, meditating, running, working out with your son, I would say, you know what? I think everything you're doing is great. I'd leave you alone, maybe every 5. It's a kind of a gestalt. It's a guess. But if it's left to guessing, I'd do every year as long as your insurance pays for it. There's something called an ultra-fast CT scan of the heart too, and most places around here you'll see like Midwest Centers for Advanced Imaging. They do CT scans, and they'll do really fast CT scans, fast so that they don't keep you there under the radiation too long, just of your heart to look for a calcium score. A lot of hospitals now, I called up Northwest Community Hospital, I called up Alexian Brothers, and they're offering it for like $100. It's pretty good. If you have a health savings account or a flex benefit account, you can actually get your doctor to write a script, and it's tax-free at least. But that tests for the amount of calcium in your heart, which sometimes, if your cholesterol is normal, calcium is high, it's another indicator that says look further into this person. So that's called an ultra-fast CT scan of the heart. That unfortunately does not, it's not unfortunate, it does not require a prescription. You can just call and make an appointment. In February, that's why I'm giving this lecture on heart disease, because February is Heart Month. It was about 3 years ago that during Heart Month they would knock it down to $50. That's great, a test for $50. But now they're across the board every month, they're pretty cheap. There's also a stress test. That's when you get on a treadmill and the cardiologist watches you closely while you're on a treadmill, and we increase, it's called the Bruce protocol. We increase the treadmill activity and the intensity of your run every 3 minutes until 21 minutes is reached. Very few people make it to 21. Some marathoners do, but usually most people will make it to about half. Some of my guys who don't exercise, I tell them try to exercise a little bit to prepare for the test so we have a good result. But anyway, that's one test, low risks for that, and if you do have a heart attack that's found, at least you're in the hospital. There's also the ultimate, the cardiac cath. That's when you get knocked out. They put a big wire in your groin, send dye, at least a little thing that injects dye, and they squirt dye into your heart as it's beating, and it shows up as a negative image on the fluoroscope. And you can see it direct. You can see your plumbing that way. If there's a narrowed stenosis, they find it. They tell your family members, and then they either do a stent or they do bypass right then and there.
What's your theory about stress tests being actually showing anything in